Regulations 2005 has been one of the key drivers for protecting our territories, as we have been all working on strengthening the way we prepare for, prevent, detect, and respond to public health emergencies. The efforts to strengthen health emergency preparedness, prevention, response, and resilience are noted. Our countries have been introduced to the Emergency Prepared and Response Flagships Initiative, which is Detect, Transforming African Resilience System, Prepare, Promoting Resilience of Systems for Emergencies, and Respond, that is strengthening and utilizing response groups for emergencies. Ladies and gentlemen, distinguished guests, COVID-19 pandemic exposed all countries, including the economically strong. As I speak now, the ECSA region is battling several health emergencies that needs our full attention. In January, the Ministry of Health of Uganda notified WHO of an outbreak of Sudan virus disease following confirmation of a case in Kampala. And this is the second reported outbreak of SVD in the country in the past 3 years. The confirmation of an SVD case in Kampala, Uganda, poses a high risk of further spread due to the case's management movements across multiple districts and healthcare facilities. And on 20 January, the government of Tanzania officially declared an outbreak of Marburg virus disease following post-mortem laboratory confirmation of a deceased patient in Kagera region in the northwestern Tanzania. And this marks the country's second reported Marburg virus outbreak, the first of which occurred in March 2023 in the same region. And in January again, 2025, the M23 armed group took control of Goma following intense clashes with the Congolese army. The upsurge in violence in Goma and other parts of eastern DRC has exacerbated an already dire humanitarian crisis. Clashes and mass displacements have severely strained essential resources, disrupting access to food, water, healthcare, and shelter, while insecurity continues to impede humanitarian operations. And if humanitarian access is not urgently restored and the fighting further escalates, the crisis risks spiraling into a large-scale disaster, driving uncontrolled displacement, worsening health conditions, and heightened regional instability. And other concerns in the DRC include the outbreak of cholera, outbreak of meningitis, and mpox. And in Malawi, the remnants of tropical cyclone Chido affected southern Malawi, bringing heavy rain and strong winds gusts, which left some people dead, others injured, and others displaced. And in Zambia, since the cholera outbreak began in December 2024, a total of 96 cases, including 5 deaths, have been recorded. I cannot list all the ongoing events, but this example shows that we need to invest more and use all our capabilities to strengthen our health systems to better prepare and respond to health emergencies and complex crises. Your Excellencies, distinguished delegates, ladies and gentlemen, in this session, we will have a presentation by ECSA Health Community on the current outbreaks in the region and advances in pandemic preparedness and response. And thereafter, we shall have presentations from member states on what strides they have taken in their respective countries to address issues of capacity building on health emergencies response and resilience. And at this juncture, I would like to call upon the Secretariat to give us that presentation. Over to you, Secretariat.
Thank you, Chair. On behalf of ECSA Health Community, my name is Muhammad Ali. I'm Senior Epidemiologist from ECSA, and I'm going to present this session on the current outbreaks in ECSA region and advance in pandemic preparedness. So to start with, we all know that ECSA region faces repeated infection, disease, threats, and other calamities due to high population mobility across the border, climate-driven challenges like flood, drought, affecting disease spread, and limited healthcare infrastructure in remote areas. So these are some of the reasons why we are having a lot of this. And as it was presented, recent outbreaks of cholera, Marburg, Ebola, Mpox, and ongoing COVID-19 are among the one of the outbreaks and highlight the region's vulnerability. So ECSA mandate is to coordinate cross-border surveillance and response together to provide the technical guidance, policy harmonization, and capacity building. In view of that, we also want to emphasize on the significance of the health security. As well, we know that outbreaks disrupt economics and livelihoods of the populations. It is strain on health system and workforce, and also there's a need to have a cross-border collaboration so that we can be able to prevent these outbreaks to move to another countries. So my presentation will be on, I will just give a spotlight of the current outbreak trends in the region, and then we also briefly discuss on the advancement and challenge in pandemic preparedness and response in the region. So as we can see, we have this 10 years analysis of the outbreaks in all the regions of the Africa, but we'll concentrate on the East and Central African region and Southern African region. As you can see from the chart, cholera outbreaks are the ones who actually take leads from the outbreaks which were reported for the past 10 years, followed by other outbreaks of disease. But the emphasis is the same, that we have many outbreaks coming, and countries like DRC, Nigeria, Uganda, Kenya, and Zimbabwe are among the countries which actually have been able to report many outbreaks on the recent year. And we don't say that other countries are not reporting or are not having outbreaks, but this is from the data which we have, we can show that majority of the outbreaks are the leading on those countries. So for the Mpox situation, as you can see from the presentation, still we have the problem. Data from WHO, which current data show that still Kenya, Rwanda, Uganda, and Burundi, and DRC are reporting the outbreaks. But cumulatively from the past year outbreak, you can see that DRC is reporting more than 12,000 cases and 581 deaths of the Mpox. So the burden is high for cholera. For the whole year, last year, we have more than 169,000 cases with the case fatality rate of 1.8. This case fatality rate is still high, as we know that high case fatality rate also it shows that we still have issues in the case management and the early treatment for the cases. We also have natural disasters reported in the region, and of the importance that we have droughts, floods, tropical cyclone, flash floods, landslide, and others from different countries. And as it was reported, Malawi, Mozambique, and other countries also reported this natural disaster. So for currently, we saw Uganda reported the Sudan virus disease. it was on, as of the 2nd of February, it was 1 case, and hopefully now things are okay. Tanzania also had a Marburg outbreak at the Kagera region, and the injury and death reported during the latest armed clashes in Goma, Eastern DRC, which causes a lot of people to be displaced. There was an issue of shortage of utilities like water and electricity, and as you know that it disrupted all the essential health services for the country. And as ECSA mandate, we had previous HMC resolutions which require as ECSA Secretariat to provide support to countries to ensure that we strengthen implementation of National Action Plan for AMR, emerging and remerging infectious disease and health emergencies, and also to mitigate effects of climate change on health, and other resolution on the communicable disease, injury, mental health, and substance abuse, among the others. So we embarked in providing support to countries, member states, and but as it was stated that we have 9 member states, but we are reaching more than that, more than 25 member states, to ensure that we implement this resolution. So the key achievement so far on this preparedness, we managed to coordinate cross-border surveillance and response, and our main support was on the strengthening cross-border surveillance through creation and enhancing of the multi-sectoral cross-border committees. Also, we support them doing the risk assessment, conducting the IHR core capacity assessment, doing the simulation exercise, and others. We also supported in the fostering joint investigation and response, and on the regional operational and analytical research. We also support the health workforce development. We support the FLTP programs. We supported countries on the surge capacity, especially training of the rapid response teams, ensure that we have a RAID team for response to outbreaks. We also support regional information system for health, emergency, and digitalization of the health sector, especially on the event-based surveillance. We actually have a regional web-based surveillance system which helps for countries which are doing the event-based surveillance to report through the web. We also have expanded existing regional e-learning system to include more programs such as infection and prevention control, AMR, and others. We also doing a lot on the collaborative multisectoral surveillance and laboratory diagnosis by providing support on the countries when they are actually rolling out their 3rd edition of IDSR, event-based surveillance, POE capacity building, and AMR surveillance. The other aspect on the lab support, where we support different aspects, including the biosafety and biosecurity, laboratory-based surveillance, including sample referral, EQA and PT panel production. This is one of the example of the strategic risk assessment which we support countries. Both it was on the using the WHO tool. We worked in collaboration with WHO, African CDCs, and other partners, both on the border points and in countries. We also, on the health emergency management and service continuity, we provide technical assistance as needed to enhance preparedness of health emergency management response, as well as the continuity of health service during the and after emergency. We went through the whole cycle of the starting with the risk assessment as it was shown previous, going to development of the national health emergency operation plans, and followed by contingency plan development, conducting simulation exercise, after action reviews, And we also participated on the PSPA, JE, and UHPR. So, in short, this is what we have been doing for the past year, and we are going to continue for this year. But we have few challenges, which these are the common challenges for many countries, which we are working with. This including the weak surveillance and early warning system, as we continue building capacity for the countries to be able to have early warning system platforms together with the electronic surveillance, so that we can be able to move out from the usual surveillance system which was paper-based, very slow and not accurate. And then we know that the human resource constraint is one of the biggest challenges still. We have a lot of people who are moving. We have areas which are not equitable having the human resource. Then there's the issue of governance and policy gaps, social and cultural barrier. During responding or doing these emergencies, we should take into account of a lot of social and cultural issues which we need to work on. And then as it was presented, the issue of the conflict and political instability, actually it hampers a lot of our efforts when we provide this support. And then we have the issue of the limited healthcare infrastructure and resource. So in short, this is what we actually were doing and supporting countries, and we are pledging to continue supporting. Thank you so much.
Thank you very much, Ex-Secretariat. We may now have statements from member states. I recognize Malawi.
Thank you so much, Chairperson. And through you, let me also thank Secretariat for that great presentation. Ladies and gentlemen, good morning. Once again, it gives me great pleasure that I present to you today at this important conference the progress which our country, Malawi, has made on this very important subject matter we are discussing today in terms of emergencies, but also in terms of crises affecting human health. Your Excellencies, Honorable Chairperson, Malawi remains committed to strengthening our health system to better prevent, detect, and respond to public health emergencies. In alignment with the International Health Regulation 2005 Monitoring and Evaluation Framework, Malawi, we recently conducted a joint external evaluation, JEE, with ECSA Health Community supporting the preparations. Key progress areas included the following: the event-based surveillance or hazard risk assessment, development of hazard response and contingency plans, as well as laboratory capacity strengthening, including accreditations, and also advancements in antimicrobial resistance response. The National Action Plan for Health Surveillance for Health Security following the JEE will further strengthen these capacities. We are also guided by the Emergency Preparedness Response Roadmap 2023 to 2025. Malawi, we have made the following strides in strengthening emergency and preparedness and response, which we have aligned with the WHO Detect, Prepare, and Respond framework. Under Detect, we are under the Transforming African Surveillance System initiative. Malawi has improved disease surveillance, enabling early outbreak detection and timely interventions. We have also established rapid response teams at national as well as district levels. We have also integrated disease surveillance and response, and we have rolled out across all 29 health districts with weekly reporting exceeding 90% completeness and timelines in 2025. Under Prepare framework, the Promoting Resilience of Systems for Emergencies PROS initiative is strengthening health systems through the following: healthcare worker training, infrastructure improvements across the board from the health post to health centers as well as district hospitals. We are also ensuring essential medical supplies availability in all our facilities. One Health collaboration and multi-sectoral IHR coordination are being strengthened. Under response framework, with WHO's support, Malawi conducted the first cohort training of the African Volunteers Health Corps on strengthening and utilizing response groups, SAGE. 63 responders trained and were deployed for floods, for cholera, and anthrax outbreaks. Plans are in place for a second cohort training this year. We have also established a national emergency and medical team to support emergency responses. Public Health Emergency Operations Center effectively coordinating responses to polio and cholera outbreaks have also been established. Simulation exercises were conducted to refine the response strategies. And finally, community engagement was prioritized to build our grassroots resilience. Challenges and way forward. Distinguished ladies and gentlemen, Your Excellency, Honorable Ministers, the main challenge remains resource constraints and also lack of logistical support. Call to action: Malawi seeks continued financial and technical support from ECSA, Health Community, from Africa CDC, from WHO, and all other partners to sustain and expand emergency preparedness efforts. Strengthened partnerships and sustained investments are crucial and critical to safeguarding public health and building resilience against future threats. Malawi remains committed to a robust, proactive, and resilient health emergency response system. Together, we can strengthen our regional health security and ensure a healthier future for all. Thank you for your attention.
Thank you, Honorable Minister from Malawi. Tanzania.
Thank you, Honorable Chair. I bring you warm greetings from the United Republic of Tanzania. It is my great honor to be part of this significant conference, which serves as a reminder of our shared responsibilities in promoting health and well-being across our nations. Allow me to express my heartfelt gratitude to the government of Malawi for their warm hospitality and to the Health Community Secretariat for organizing this important event. This gathering provides a valuable opportunity to share insight and progresses on critical health issues affecting our region. Honorable Chair, emerging and re-emerging diseases, along with other health emergencies, are on the rise and are likely to continue. This highlights the pressing needs for sustained regional cooperation and is strengthening the capacities to ensure that we are fully prepared and can enhance regional health securities. Honorable Chair, Tanzania has made significant development in building capacity for health emergencies, response and resilience, and this has included effort in health promotion, community engagement, measures for travelers at point of exit and entry, and early warning system, diagnostics and patient care services, logistic and supply management, coordination, as well as strengthening the health workforce. In March 2023, Tanzania faced its first ever outbreak of MVD in the northwestern region, I am proud to say that we successfully contained outbreak in less than 3 months, thanks to the collective efforts of various stakeholders, ECSA being one among them. But just recently, on January 2025, we declared a second outbreak in a different district within the same region. We urgently place the response measures, and we remain hopeful that we will soon gain complete control of the outbreak. We would like to express our sincere gratitude to the ECSA health community for their readiness to support the cross-border response to MVD, and your assistance has been invaluable. Honorable Chair, Tanzania reaffirms its commitment and solidarity with the ECSA health community. We call on ECSA health community to continue providing strong support and coordination for the College of Public Health Physicians, whose expertise is invaluable during the health emergencies. It is time for the region to adopt a sustainable solution to support the local production of vaccine, medicines, medical products, and reagents. Thank you. And reagents. I applaud the ECSA health community for taking the lead in organizing this conference. It is a platform for critical decision making, and it is a time for actions to be taken to ensure our region reaches its full potential. Ziko Mpambile, thank you for listening, and asante sana.
Thank you, Honorable Minister from Tanzania, Uganda.
Thank you, Chair, Honorable Minister, and all protocol observed. I bring you warm greetings from Uganda. I'm sitting in for the Honorable Minister, who is not with us, but she's on the way coming. So I will deliver her statement. Honorable Chair, the countries in the region as signatories to the International Health Regulation 2005 mandates member states strengthen capabilities for health security, to make significant strides to develop minimum core public health capacities, to implement the International Health Regulation 2005 effectively through various initiatives and collaborations, including multi-sectoral approach, leveraging the principles of One Health, with significant engagement in the process from MDAs, ministries, departments, and agencies, and other stakeholders. This multi-stakeholder approach reflects a shared commitment to enhance collaboration when addressing national health security. The Ministry of Health implements a government-owned internal health regulation framework that includes compliance with the 4 components of the International Health Regulation Monitoring and Evaluation Framework. A joint external evaluation, which is normally conducted after 5 years. The last was in October 2024 for our country. Annual state party report, after action reviews and simulations. The results of these assessments, including other assessments like risk assessments, inform the development and focus of the National Action Plan for Health Security that defines the strategies, actions, and priorities that the government will adopt to improve the country's ability to prevent, detect, and respond to public health emergencies for a streamlined implementation. The healthcare system's epidemic response capacity involves both government and private sectors, each with its own infrastructure and capabilities that are synergetic during the response. The Ministry of Health coordinates the government response to epidemics through the structured incident management system that allows for effective coordination, resource mobilization, and utilization. And this is the same system that we are using now as we deal with the EVD outbreak, like you've been told. The operationalization of the public health emergencies, this is another strong aspect. Public health emergency operation centers, which are both at national and regional level, have provided a platform for multi-sectoral collaboration during response to public health emergencies. We have also strengthened and utilized response groups for emergencies that are deployable within the region to guide swift response efforts and minimize disruptions in continuity of essential services during public health events. As we all know, even during public health emergencies, essential services must continue. So that is one effort that has been done in that direction. We've done workforce development, built capacity of rapid response teams, emergency medical teams, the rapid response teams, and regional training, of such members. We've also trained epidemiologists through public health fellowship programs, and part of our teams are actually in this country undertaking a fellowship program. So that is, one area through which we are also handling the capacity building aspect. Availability of infrastructure. We've designated isolation facilities to quarantine and treat individuals suspected or confirmed to have infectious diseases. There is a strengthened laboratory network in the region capable of diagnosing infectious diseases, including those with epidemic potential, supported by effective sample transport network and electronic results sharing system for feedback. This plays a crucial role in early detection and containment of efforts. As we talk right now, one of the areas where we have the EVD, suspects is in Mbare, the eastern part of the country, and we've deployed a mobile laboratory, van that is able to pick samples and test them. And some of the EVD cases, of the Ebola cases, samples have been tested within the region and results provided there and then immediately. So vaccine development and clinical trials to address vaccine preventable diseases and develop the medical countermeasures, including therapeutics and epidemics and pandemic diseases. We've also ensured collaboration with international partners, including the World Health Organization, already in the room, and we appreciate. The Centers for Disease Control and Prevention, we appreciate, and others in strengthening emergency response capacity through training, surveillance enhancement, and support for emergency operation centers. These efforts enable swift response to outbreaks and complex health needs. The challenges have already been highlighted. Health financing still remains a challenge within the region. The capacity of our human resources, especially specialists, is still also a challenge. And we want to appreciate, the ECSA, infrastructure that has been put up in place to build the capacity of human resource within the region. I thank you, Honorable Chair and Honorable Members.
Thank you, Uganda. I see Kenya.
Thank you very much, Chair. I would like to convey warm greetings from the Cabinet Secretary, Minister of Health, Honorable Dr. Deborah Baraza. So I'll read this statement on her behalf. It's a great honor and privilege to be part of the 74th ECSA Health Ministers Conference here in the beautiful and warm heart of Africa, Malawi. We are indeed delighted to be part of this esteemed gathering, which brings together leaders, experts, and stakeholders committed to advancing health systems and ensuring equitable access to quality healthcare for all our people. As we convene under the theme Looking Ahead Beyond the Golden Jubilee, we recognize the urgency and importance of strengthening our regional collaboration in tackling emerging and persistent health challenges. Kenya has made significant strides in strengthening its capacity to prevent, detect, and respond to public health emergencies while enhancing resilience to health threats. These efforts are guided by the implementation of the International Health Regulations 2005 that provide guidance on the establishment and sustainability of core capacities for public health emergency management. The country has further conducted an IHR capacity assessment by conducting the joint external evaluation in 2024 and is currently developing the National Action plan for health security. On disease surveillance and early warning system, Kenya has a robust disease surveillance system, including event-based surveillance that enhances the ability to early detection and response to public health emergencies. The country is currently rolling out the 3rd edition of the Integrated Disease Surveillance Strategy. Up to the community level, the country is also scaling up evidence-based surveillance to all the 47 counties. Cross-border surveillance system has been strengthened through partnership with the East African Community, WHO, Africa CDC, ensuring that there's rapid detection and containment of cross-border threats. On coordination of public health emergency response, the country has a national task force that is mandated to provide strategic guidance on response to public health emergencies, as well as resource mobilization. The National Public Health Emergency Operations Center has been fully operationalized, serving as the national coordination hub for emergency response. It has improved real-time event detection, risk assessment, and response coordination for outbreaks like mpox, cholera, and preparedness for viral hemorrhagic fevers. The country has established 25 county emergency operation centers in high-risk counties to enhance emergency coordination at the sub-national level. Kenya has also institutionalized the incident management system, enhancing the rapid deployment of emergency response teams and ensuring structured response mechanism. On laboratory capacity and diagnostic strengthening, the National Public Health Laboratories and other national reference laboratories have expanded their capacity for genomic sequencing, pathogen identification, and antimicrobial resistance surveillance. We also have decentralization of the laboratory services, and a robust referral network have improved access to rapid diagnostics for priority diseases such as Ebola, Marburg, and influenza. On workforce development and emergency response training, Kenya has invested in field epidemiology training program, FELTEP, building a skilled workforce for outbreak investigation and emergency response. In 2023, the country conducted the African Volunteer Health Corps surge training, where 120 officers were equipped to respond to public health emergencies within 24 to 48 hours. Regular simulation exercises and emergency response drills have been conducted to enhance readiness and coordination among response emergencies. On risk communication and community engagement, risk communication strategies have been implemented through community-based surveillance, public awareness campaigns, and also social behavior change initiatives. Engagement with community health promoters, religious leaders, and media outlets has strengthened public trust and response efforts. On strengthening health system resilience, Kenya has inaugurated universal health coverage strategies to build resilience against health shocks in the government's bottom-up economic agenda. Integration of continuity of essential health services during public health emergency response is critical to prevent excess morbidity and mortality from non-emergency health conditions. Therefore, Kenya has made commendable progress in building capacity for health emergencies response and resilience. However, challenges such as funding gaps, emerging health threats, and climate change-related risks still persist. And therefore, strengthening multi-sectoral coordination, research, and sustainable financing will be key to further enhancing the country's health security. We commend the health community for fostering collaboration among member states and strengthening health policies and sharing best practices that enhance service delivery in our countries. Kenya remains committed to the vision of ECSA and is dedicated to improving health outcomes through universal health coverage, investment in primary health care, and the digitalization of health services. We strongly believe that through collective action and shared resources and strong leadership, we can accelerate progress towards achieving the Sustainable Development Goals and the African Union's Agenda 2063. Thank you, Chair.
Thank you, Kenya. Eswatini.
Thank you, Chair, for the opportunity. Warm royal greetings from the Kingdom of Eswatini. Eswatini is going through an epidemiological transition and experiencing double burden of disease. Public health events in Eswatini includes cholera, measles, and COVID-19. While communicable diseases still remain a serious challenge, non-communicable diseases, particularly hypertension, diabetes, and cancers, are growing problems resulting in high morbidity and mortality rates in the population. Routine data showed that NCDs in 2017 accounted for 30% of the outpatient cases and 14% of the inpatient cases. Eswatini's public health boasts several strengths that contribute to its capacity to detect, respond to, and manage public health emergencies. These include: 1, strong political will and legislative support. Legislation such as the National Disaster Management Act and the Environmental Management Act support the country's preparedness and response efforts. 2, multi-sectoral coordination. Eswatini has developed a collaborative framework that brings together various sectors, including health, agriculture, environment, and security forces to address public health emergencies. 3, strong technical leadership by the IHR focal point. The country has established a designated IHR focal point consisting of a secretariat with 8 personnel from various sectors like health, environment, and veterinary services. This secretariat operates 24/7 and is responsible for coordinating and responding public health matters with WHO. Strong international partnerships. Eswatini's collaborations with international organizations such as WHO, Africa CDC, and IAEA has strengthened the country's health security capabilities by providing technical assistance and capacity building. Public Health Emergency Operations Center. And 6, key highlights include the development of high-level guiding documents such as the Strategic Tool for Assessing Risks, STAR report, the National Health Emergency Response Operations Plan, and specific contingency plans. Additionally, the project managed to test the readiness of the country towards response to an incident through the first ever full-scale simulation exercise. And 7, 58 trained and certified ready to be deployed ad hoc search team that we call the Ngwe team is also an additional 400 healthcare professionals trained in basic public health emergency by Eswatini PHM Academy. While Eswatini's public health system has notable strengths, there are significant challenges that prevent the full realization of its capabilities. That include limited resources. The country lacks specialized personnel in key areas such as surveillance, IHR coordination, and health emergency management. The shortage of skilled staff, particularly at the regional and local levels, limits the effectiveness of surveillance and response activities. And resource constraints. The country relies heavily on the external partners for funding its public health preparedness efforts. Limited domestic resources mean that the sustainability of emergency stockpiles, laboratory capacity, and surveillance systems remains uncertain. Thank you, Chair.
Thank you, Honorable Minister from the Kingdom of Eswatini. I recognize Mauritius. You have the floor.
Thank you, Madam Chair. Honorable Ministers, Excellencies, Acting Director of ECSA, respected delegates, distinguished guests, health expert and administrators. All protocol observed. To start with, I have to present sincere apologies from my Honorable Minister who just took office 2 months ago, and knowing the intrinsic nature of Minister of Health, he could not make it. As we would say right now, this is a 24/7 job. So he doesn't have time. He has plenty of things to do. He has time, but he sent me to replace him. Even if he's not physically present, his total commitment to all the issues to be discussed and decided is there. Before I start the formal statement, Madam, permit me, because we are just pre-lunch, to give food for thought for everyone. Thank you, Madam. First of all, we have been hearing for years, resource is a commitment. It will come for centuries also. Resource will always be a problem, but we should know where to put it. It's good that development is essential for every country, but without a healthy population, it doesn't make much sense. So as policymakers, I will urge all the ministers, including mine, to think before we allocate resources. The session is about building capacity on health emergency. We tend to think COVID-19 is among the main emergency which happened. I'm sorry to say, I feel diabetes in most of the countries, including Mauritius, is an emergency. Cardiac problem, HIV, etc. Post-COVID death, which I can't explain. Youngsters of 30 years are dying of cardiac arrest. No one knows why. And perhaps everyone says it might be COVID, but it is an emergency. If all my youngsters disappear tomorrow, how am I going to run the economy? At the same time, when we are talking about commitment, we know that ministers are committed to health, but we need to ask our ministers also to get the commitment of their government and our government. As we all know, public health is a cornerstone of national health security. It ensures disease prevention, surveillance, rapid response to emerging and re-emerging of health threat. Under the purview of the Ministry of Health, several specialized units operate collaboratively to strengthen our public health infrastructure. These units include Communicable Disease Control Unit, Central Health Lab, Public Health and Food Safety Unit, Environment Health Engineering, Vector Biology and Control, Infection Prevention Control, and Government Analysis Division, among others. Each one have their role to play. But if they don't work together, we can't do anything. If we want to mitigate the impact of communicable and non-communicable disease, we have to enhance our national preparedness for public health emergency. Although we can claim safely that COVID-19 was not foreseen, but in my humble opinion, we knew that it is going to happen. It can recur again, but we don't know which forms. When we are talking of all the units under my unit, under the ministry, we talk a lot about early warning system. Knowing that it will happen doesn't solve the problem. Resources help, but what about the capacity building? Do we have people who can fix it? We know from our experience that during COVID, everyone was running to have a vaccine. We don't know whether the vaccine was the correct thing to do or not, but we ran and we had it. 3 doses of it because we didn't want to die. But we don't know whether we are going to survive or not. So we need to think about it without the box. What should we do? can we forecast it? If we can't forecast it, at least let's sit down regularly, more regularly in the African continent and think what we should be doing. One of the things we should know that not only collaboration, but resource should be shared among ourselves. We are not talking of finances, we are talking of human resources. We are talking of people who know. Doesn't mean that if we are in this continent, we don't know. We might know better than many people. But we need to channel these resources in the right way. We need to have laboratories which gives us enough data so that we can do things which we need to do. We keep on talking about food security and food safety. Are we really ready? And we have the key function that we are supposed to do in terms of quality assurance. We have sectors like my sector is about vector biology and control division. They monitor, surveillance and control vector-borne diseases like malaria, etc. But controlling, does that mean reducing? Are we effectively reducing these things? Now, Infection Prevention and Control Unit. This develops National Infection Prevention and Control Unit. I always say, I'm an administrator, madam, forgive me. Its policies are good, always the best on paper. Without proper implementation, it doesn't mean much. To continue in this, I want to tell you what are the things we think in Mauritius that we need to strengthen our health emergency preparedness, coordination and leadership. Leadership at all levels, from top to bottom. We need to have surveillance, rapid response, case investigation. Okay? Up to now, no one can tell you for sure, at least in Mauritius, how many people we lost due to COVID-19. Was it only COVID-19? Was it something that we failed to realize, or we didn't want to realize? The other thing is we have, fortunately, madam, Mauritius is an island, so I can control the port and the airport. But Africa, we cannot do that. So we need to screen. We cannot, as in French they say, avoir le bras croisé, means sit back and sit on the fence and watch. We should always be vigilant. We have to comply. And we have to share information all the time in our port of entry. When we are talking of laboratory diagnosis, it's good. Are we up to date? Do we have all the data? When we are talking of case management and clinical care, do we have a standard protocol? Do we really follow the WHO protocol? When we are talking of risk communication and community engagement, do we engage the community? Are the community aware? I know there was a lot of issues, at least in Mauritius and in Africa and everywhere. People didn't know what is happening for COVID. So someone comes and announces 50% are having COVID, 10 of them died. Then what? Okay, so we need to strengthen the health emergency preparedness and response. This is only being done and only will be done through training and capacity building. This is a permanent thing. We need to capacity build. Otherwise, what will happen? Nothing. Our achievement in pandemic preparedness, we claim that we did well because we don't have real numbers and data. So we can safely claim we did well, we did well. Did we do well? I don't know. I'm sorry to say that. Forgive me, Chair, I'm very direct. When we are implementing our multi-sectoral collaboration, did we really collaborate with all the countries who are there? We have risk of assessment at port of entry. When we talk about way forward, madam, we need to think and agree. We need to be united. Sharing knowledge is the key. We should have total commitment, not only from our ministers, government, administrators, professionals. We work on one side. We are fighting AIDS in disease. Okay? We are not fighting among ourselves. With this word, I would like to say, Madam, this is the start of all the challenges that we are going to get in the next century to come. Unless we think without the box, nothing will happen. Thank you, Madam, for listening. Thank you, Excellency. And I'm sorry I was thinking without the box, but I made you think. Thank you.
Thank you, distinguished delegate from Mauritius. You took the whole 10 minutes.
Sorry, ma'am.
I'll now give the floor to the Kingdom of Lesotho.
Thank you, Chair, honorable ministers, distinguished guests, ladies and gentlemen. Capacity building has emerged as a key component in addressing public health emergencies. In this regard, the Kingdom of Lesotho, with the support from the World Health Organization, has trained 49 African volunteers for COVID-19 health surge responders, who are now listed in the Africa CDC and WHO databases. Furthermore, through the Africa Field Epidemiology Network support, 10 cohorts of frontline field epidemiology officers have been trained. The country has also developed a comprehensive training plan to build international health regulation expertise across different capacities. Distinguished ladies and gentlemen, the Kingdom of Lesotho, in partnership with its sole neighboring country, the Republic of South Africa, has established cross-border surveillance collaboration committees, which has 6 zones. These zones have convened virtually to address pandemic-related issues, and recently the issues around Mpox. This cross-border collaboration aligns with the Article 44 of the International Health Regulations 2005. The country has also enhanced early detection mechanisms, integrating event-based surveillance systems into our traditional surveillance systems. This initiative, supported by Africa CDC and the World Health Organization, has further strengthened through the introduction of digital mobile applications. These applications enable event-based surveillance, focal points, and communities to report public health signals promptly, ensuring timely responses. I thank you.
Thank you, Lesotho. I don't see any other member state. I will now open the floor for discussions, comments, and questions, if there are any. I don't see any comments. I think we'll now come to the closure of the session. And in summary, I think the issues that were raised here were significant strides that have been made in member states, especially in capacity building of our people, the robust surveillance system responses which are necessary, We also have to strengthen cross-border surveillance and the simulation exercise to show our readiness. And then we also need to have public health emergency operating centers. And there were also challenges posted by the speakers. The biggest challenge, I think, is the one of financing. The member states have to explore the domestic financing of our health services and reduce dependence on external financing. And this therefore needs the commitment of our governments to inject more funding into our health sector. And the other issue that was raised as a challenge was regarding the human resources, the specialists, laboratory diagnostics, and others. And what needs to be done? We need to enhance our public health preparedness. We need commitment as governments, inject more funding, and we have to also strengthen our laboratory diagnostics, and the implementation of policies was also strengthened, coordination and leadership, among others. I think with this summary, we have come to the end of this session. Can we give us a round of applause? Thank you.
Thank you so much, all the presenters. We are not, haven't been updated whether lunch is ready, but we're supposed to break at 1. It's only 10 minutes. The best we can do is maybe come back 10 minutes earlier so that we catch up on time, if that is agreeable. Otherwise, thank you so much for the wonderful work this morning. We reconvene at 10 to 2. Thank you so much. And as we are getting out of this room, let's make sure each one of us, we get a meal coupon. Lunch will be served at the foyer, in the other building, not where we had refreshments, but the one up there. Yeah, thank you so much.